All right. So we're 4 minutes past the hour. I think people are still joining, but let's get started. Again, my name is Michael Kinnucan. I'm the Health Policy Director at the Fiscal Policy Institute, which is a progressive New York think tank, looking at how to make New York livable and affordable for working people. And I will be presenting on, let's see, I will be presenting on the impacts of the recently released House Republican reconciliation package on New York's healthcare system. And the news is mostly bad, I will say. Now, I'm going to sort of work through this. There's a lot of complex issues at play, so I'm just going to talk through them and sort of talk at you for about half an hour, and then try to leave some significant room at the end for questions and also for discussion, because I think some of the people on this call can teach me a lot about these issues. So I want to have this be a space where we learn from each other and acknowledge the unknowns. But for now, I'm just going to talk really quickly. And if you have questions sort of as they come up, just drop them in the chat and we'll try to work back through them. I think we all know, House Republicans back in February committed to a reconciliation package that would have involved several $100 billion of cuts for Medicaid. But what hasn't been clear until this Monday was exactly how they were going to achieve those cuts. What specific programs and mechanisms and sources of funding were going to be eliminated. On Monday, we found that out, and many of us have been rushing to sort of analyze what it all means. I think for some of us, there was an initial sense of relief because of some of the sort of worst case scenarios that we'd been contemplating and imagining, like, per capita caps or block granting or totally eliminating the enhanced federal match for the ACA expansion. Those were avoided. And so I know I, for one, read the news on Monday and was like, okay, maybe it's not that bad. But that was really, it turned out totally incorrect. As we get deeper into the bill and analyze it more carefully, they've done a different set of cuts that are really, really damaging, both nationally and really especially for New York as a state with an especially ambitious Medicaid program, and also a state with 4.5 million immigrants, of whom 1.8 million are non-citizen immigrants. This bill is an enormous threat to our healthcare system, and so I just want to start there. That this is going to be really, really challenging for the state if it's enacted in anything like its current form. And then I want to say the good news, right, is that this process isn't over. Swing district Republicans in New York probably don't understand exactly every element of this bill and how damaging it might be to New York. What they do understand is that healthcare cuts are unpopular, right? That's why some of the worst case scenarios are not in the bill. That's why some of other elements of it are delayed in implementation until after the midterms. And so we do still have time to fight back on this. And I want to just share a graphic on the reconciliation timeline that the Center on Budget and Policy Priorities has created that's really helpful. I think it shows, we're close to a potential House vote next week. We'll see if the caucus is even unified enough to do that by that time. But even then, there's a Memorial Day recess and more politicking, a mid-June recess, and then we're looking at a final vote in August, so we still have time to approach this. So let me talk about what the bill actually does in some detail. And there are a lot of bad things in this bill, frankly. I could give a 6-hour presentation on them, but I wanted to just narrow it down and I think sort of make sense of the things that I see as the most threatening both in terms of the amount of money and coverage that's at stake for New York, and also in terms of the timeline. So, thing one, the New York Essential Plan, which covers 1.6 million New Yorkers, is in really, really serious jeopardy, to the point where if this bill passes, the Essential Plan might need to be wound down. So I want to lead with that. That's a huge amount of money and a huge amount of coverage for New York. The bill also punishes states that cover undocumented immigrants, even with state-only funds. That puts $2 billion a year of New York federal funding at risk. New York's MCO tax, which is this sort of wonky source of financing the state started using just this year to sustain its Medicaid program, could be eliminated as soon as January 2026. So the state budget that we just finished could be in disarray and need to be renegotiated if this bill passes. Mandatory work requirements and other sort of changes to eligibility that are in this reconciliation bill and are sort of the timeline for them is a little extended right now. So they wouldn't happen immediately, but they would require the state to invest an enormous amount in essentially building a red tape wall that prevents people from accessing healthcare. And then they would lead to people being kicked off healthcare. And finally, the bill comes for a form of New York State financing for safety net hospitals, and a form that other states use as well, called state-directed payments. This has become the main way that New York State supports safety net hospitals. There's a moratorium on new state-directed payments, so there wouldn't be an immediate impact on many of the safety net hospitals in New York that already get those payments. But New York City Health and Hospitals is actually waiting on a state-directed payment right now and will face a really serious budget shortfall if it's not approved, which it now looks like it won't be. So these are sort of the big five. I'm going to talk about each of them in turn to explain sort of what the risk is, where it's coming from, what the impact would be on New York. And then I'm going to sort of throw out a bunch of other smaller cuts that we can take up in the Q&A. But the Essential Plan, number one, so the Essential Plan is separate from the New York State Medicaid program. It covers 1.6 million low-income people in New York State, up to 250% of the federal poverty line. And it's really one of the best things that New York State does, because it essentially replaces the ACA exchange in New York State. So folks who have been on the ACA exchange might have had the experience of, like, you pay a lot every month, your deductible's really high, sometimes it's not great coverage. The Essential Plan replaces that for low-income people and offers a much, much better plan that is zero deductible for most people, zero premium, and it provides really comprehensive coverage. And it's specifically aimed at two groups of people, US citizens who are sort of over the Medicaid limit. They make more than 138% of the federal poverty line, but less than 250%. So low-income US citizens, but not so low income that they're on Medicaid. And then non-citizen lawfully present immigrants who make less than 250% of the poverty line. So either, they may or may not be eligible for Medicaid from an income perspective, but because the federal government doesn't allow most categories of immigrants to access Medicaid, they're instead funded through the Essential Plan. And now the way this program is funded is really related to the ACA exchange. And so whenever you hear in the reconciliation process that something is happening to the ACA exchange or to premium tax credits, you got to think that's probably going to be a cut to the Essential Plan in New York. And in this case, it's a really, really severe cut. So the total federal funding for the Essential Plan is $13.2 billion in New York State. And that's the whole funding. The state doesn't put in a dime. And of that cut, of that 13.2 billion, we could lose as much as 7.5 billion. And the reason for that is that the reconciliation bill says legally present non-citizens who are currently eligible for the ACA premium tax credit, they will no longer be eligible. They will be kicked off, starting with one category in January of 2026 and continuing with almost all categories other than green card holders in January of 2027. And so what that means is that 500,000 essential plan enrollees who are under 138% of the federal poverty line would lose coverage, and likely another 500,000 who are over the federal poverty line, like a huge number of people. And so specifically, I'm sorry, this table is a little hard to read, but almost all of the folks in the sort of EP3 and EP4 categories, so under 138% of the poverty line, that's 500,000 people, would lose coverage. And then a bunch of the other million people on the plan would also potentially lose coverage. Now, the key here is that those folks, them being eligible for federal participation brings $7.5 billion into the EP. When they lose eligibility, that $7.5 billion will go away. And so essentially half of the essential plan total federal funding will just be gone. That likely means that the essential plan will be destabilized even for US citizens who use it, right? Like that will have to unwind the whole thing. And it means even if we do unwind the whole thing, we're still out $7.5 billion of coverage, right? We're not getting it in premium tax credits either. So what does that mean? It means, that loss of the essential plan, $7.5 billion. But also, New York State's constitution guarantees equality in healthcare for lawfully present immigrants, which means that the folks on the essential plan who are under 138% of the federal poverty line will qualify for New York State Medicaid for state-only Medicaid. So they will all move over into state-only Medicaid. That will cost the state another $2.7 billion, and that's state only. There's no federal match on that. So we're now up to $10 billion a year of loss for the state. And essentially, what we'll see is that the essential plan will likely disappear. Folks under 138% of the federal poverty line will move over to Medicaid. The state will pick up the tab for that. That will squeeze the state budget. Folks over 138% of the federal poverty line, if they're immigrants with legal status, they're now not eligible for Medicaid. They're not eligible for the essential plan. They're also not eligible for premium tax credits. So that other several hundred thousand to 1 million people will simply become uninsured, right? So that's, almost 5% of the state population. And all of this is going to have an impact on providers as well, right? Hospitals get paid the least by Medicaid, and they get paid nothing for treating uninsured people. And so the state has released some estimates that the cost to safety net hospitals would be on the order of $1.4 billion in that kind of uncompensated care. And there's also, even all of this aside, the enhanced premium tax credits that Biden passed are being allowed to expire at the end of the year, which will also be a hit to the essential plan, and will also hit the exchange population. So the 260,000 people in New York who buy insurance on the individual market will see their premiums increase dramatically. So, I can't say emphatically enough that this alone, if there were nothing else in the reconciliation bill, would be a catastrophe for New York. It would essentially reverse all the progress we've made on lowering our uninsured rates since the passage of the ACA. It would lead to hospital closures. It would leave, 1 million people uninsured. So it's really very frightening. Next provision, punishing states that cover undocumented immigrants. So we've all heard Republicans say, look, I am we're going to save money on Medicaid by taking it away from undocumented immigrants. As a matter of fact, the federal government does not fund Medicaid for undocumented immigrants. So it's hard for the federal government to save money when it's not already spending that money. Some states choose to, out of their own pocketbooks without a federal match, provide Medicaid or children's health insurance program coverage to some categories of undocumented immigrants. New York is one of 14 states that does this. So it's not uncommon. Predictably, it's mostly blue states, but not exclusively. And the reconciliation bill says that if you provide coverage for undocumented immigrants, even if it's purely at state expense, in fact, even if it's not part of the Medicaid or the CHIP program, it's just a separate program, then you will get a large cut to your federal match for the ACA expansion population, a 10 percentage point cut. So right now, the federal government pays for 90% of the cost of insuring that ACA expansion population. For states that cover even a single undocumented immigrant, it will cut that to 80%. In New York, that could be up to $2 billion a year in lost federal funding starting in 2027. And I just want to emphasize here, this isn't the federal government cutting the spending it's doing on undocumented immigrants. It's cutting the spending on US citizens who are in the ACA expansion population to punish the state for covering undocumented immigrants. And in New York, it's mostly children that we're talking about. In most states that do this, it's mostly children. It's folks on the children's health insurance program, and also some seniors in New York are also eligible. So that's troubling. The next category cut I want to talk about is the MCO tax. I've written a lot about this because I like Medicaid minutiae. So if you want to know more about the MCO tax, you can go to our website and find out. But basically, it's a financial maneuver that allowed New York State and a handful of other states to support Medicaid spending by sort of drawing down more federal match than they would otherwise. The state levies a tax on its own MCOs and then pays them back and draws down a federal match. The tax is expected to support almost $8 billion in state and federal spending. The accounting is a little complicated in New York in the next 3 fiscal years. And we just settled a budget that really relied on some of this money to support general Medicaid, to support safety net hospitals, and to give a bunch of rate increases to various providers. The reconciliation bill and also a recent Trump administration rulemaking are threatening to sort of cancel this MCO tax really quickly as soon as potentially late this calendar year or early next calendar year. That's a real surprise because the tax was just approved for 2 years in December. And usually when the federal government sort of decides it doesn't want to fund something like this, it will give the state at least a fiscal year to adjust to it. They're not doing that in this case. They're cutting it immediately. And so that really means, like, if this bill passes, then the budget we just negotiated is going to be, it's going to need to be renegotiated. It's a significant amount of money. I want to talk next about something that's gotten more coverage than the stuff I've talked about so far: work requirements and other eligibility checks. So Republicans are proposing mandatory to require states to do work requirements for adults who don't have a formal disability status and aren't children, don't have children. They're also requiring states to do eligibility checks twice a year instead of once a year, and they're also requiring states to charge copays to Medicaid recipients who are between 100 and 138% of the poverty line. For reference, these are people who make $16,000 or $17,000, like $17,000 a year. So I don't, they don't have a lot of money to pay. The purpose of these requirements is not really to make sure that Medicaid recipients are working. We know, the research shows that most Medicaid recipients are either working or they're in school or they have a dependent or they're caring for an elder. They meet one of the exemptions for the work requirements. But the truth is, anyone who's ever, been to the DMV or dealt with any kind of government bureaucracy in a serious way knows that it's easy to just miss an email, miss a letter, your address changes or something. You fail to fill out the right paperwork, and then you lose something or something's delayed. In this instance, we're talking about people's health care. The research is really clear that work requirements cause people to lose health care, even though most of the people who lose healthcare are actually eligible, right? Like if the paperwork weren't a barrier, they would have it. So this is primarily a way to just cut Medicaid spending by kicking people off. They're also expensive. Like the New York State will have to build a big IT system and sort of paperwork system and hire a bunch of people just to sort of check work requirements and institute copays and everything. So there's also a wasteful administrative spending component to this. And now you know this is the biggest single saver in the reconciliation bill. By itself, it's supposed to save $300 billion a year, or sorry, not a year, but over the next 10 years. But its implementation is delayed until the end of the Trump administration in the bill as it currently stands, which I think is telling. It says, Republicans understand that this will be bad and unhelpful and unpopular, and they want to sort of kick the can on it. But recent reporting in the past 2 days indicates that actually House Republican hardliners aren't happy with that. They want to move the work requirements up so they would happen sooner. And, they would save more money by kicking more people off sooner. And so that's something to really watch. If those get sooner, it will become a much more frightening and costly thing for New York. Finally, I want to talk about state-directed payments. This is not a huge amount of money immediately, but it's a big issue for health and hospitals, which is why I raise it. So a state-directed payment is a way that states have to support safety net hospitals by requiring Medicaid MCOs to just sort of pay more to the safety net hospitals. Specifically, the state can require them to pay the same thing that commercial insurance pays, right? Which addresses inequities in the health system. The Republican reconciliation package would ban that. It would say states can't pay safety net hospitals up to the commercial insurance rate. They'd be capped at paying up to the Medicare rate, which is half as much. That could potentially be a big problem in New York in the long term, because New York spends about $1.6 billion on safety net hospitals through this mechanism. As of now, existing SDPs are grandfathered in. It's like you can't do new ones, but the existing ones are okay, which prevents some sort of immediate pain that could happen. The exception here is New York City Health and Hospitals is currently waiting on federal approval of an SDP. And in this past state budget, the state actually canceled some of its other safety net funding because they expected it to get approved for this SDP. Now it probably won't ever be approved. And so now effectively the state budget has cut health and hospitals funding, and that is going to be a big funding hole for health and hospitals. So just reviewing, I kind of ranked these in order of how much terror we should feel about them and how bad they'll be for the state, how soon. But they're all, each of these is really bad. and the impacts start building up quite quickly within this and the next fiscal year. So it's really worrisome. There are a lot of other bad things in the reconciliation bill that I did not cover. There's a restriction on people accessing LTSS if they have more than $1 million in home equity, which probably sounds like a lot in Louisiana, but is not necessarily a lot in New York City. And historically, the asset limit has been adjusted for inflation. Under this bill, it wouldn't be adjusted. And so over time, this would increasingly mean that elderly New Yorkers would have to choose between staying in their home and accessing Medicaid LTSS. There's a lot here. So historically, the federal government has allowed states to give immigrants 3 months to sort of, to give Medicaid enrollees 3 months to prove what their immigration status is. That would be changed to 1 month, right? So it's another sort of combination of a paperwork barrier and a state cut. There's a moratorium on new provider taxes and state-directed payments. So this is kind of like, Republicans sort of would have preferred to eliminate these things entirely, but many blue and red states depend on them already, so they decided not to cut them for states that already have them, but just to sort of freeze them in the status quo. That what that will kind of result in is like 10 years from now, we'll be talking about, oh, why do we have that stupid state-directed payment that's structured badly and doesn't serve state needs anymore? Well, Republicans decided that we just had to keep it forever because we couldn't adjust it as our needs changed. There are changes to ACA enrollment and eligibility, tougher checks on income, shorter enrollment periods that will cut federal funding that way. And there's a ban on federal funding for gender-affirming care for minors. The state can and should make up that gap, but it's sort of just another instance. And there's a lot else. And just to emphasize sort of when this is happening and at what stage, there's stuff that will start impacting us immediately in this fiscal year. So like in the New York State fiscal year runs from this April to next March. And some of these cuts could start having really harsh effects in the final quarter of this state fiscal year. In the MCO tax, elements of the essential plan risk, health and hospitals funding issues, which is an argument I would say for, the legislature. If this or anything like this passes, the legislature may need to reconvene at the end of the summer to decide how to deal with it. And then next fiscal year, things get really bad for the essential plan, and the cut related to undocumented immigrants also comes due. And then so far, work requirements and other kinds of changes like that are a little farther in the future, 3 years out. But again, that could change, and we need to keep an eye on it. And just to emphasize, the impact of this is really bad. It would be bad for people who lost insurance, which could be, easily over 1 million people. It would be really bad for the providers that communities depend on, right? Like there are a lot of New York State hospitals that do vital work in rural areas and in low-income urban areas that are always on the knife's edge financially, and seeing a huge uptick in uninsurance or downward pressure on provider rates could put them over the edge. There would be a really large overall budgetary impact here, right? So when I say that the state would lose, $10 billion that it's currently using to cover essential plan enrollees, I don't mean to say that only essential plan enrollees would be impacted. The state would then have a choice, and it would have to, make decisions about like, okay, is it gonna totally cut coverage for everyone? Is it going to try to protect coverage for children who are legal status immigrants, but then do that maybe by cutting eligibility for home care and kicking people off home care? Is it going to squeeze its education budget? Right? There's this really broad effect that will happen. And so there's an attempt to sort of describe this bill as targeting cuts at specific populations, right? At undocumented immigrants or at lazy people who don't work or whatever, but it's going to really impact all of us. And so I want to just sort of talk about a couple of talking points that I think have been circulating on that. Again, the claim that this bill sort of lowers the federal deficit by targeting undocumented immigrants and lazy adults who don't work really doesn't hold up to scrutiny because, number one, the federal government already doesn't pay for undocumented immigrants. 94% of Medicaid recipients already work. I think there's this perception in the halls of Congress that there's this huge population of people who are just sitting with their feet up watching video games. In New York City and New York State, you can't make rent while doing that. Most people are working, or if they're not working, they have a good reason for not working, or are unable to work or caring for someone. So, and then the vast majority of people in New York who would lose coverage are lawfully present immigrants and U.S. citizens. And so, that's where the impact is. There's also there's been a claim of, Medicaid was designed to help elderly and disabled people and single mothers, and, we're protecting them. We're only going after these other categories. Again, I mean, a couple of things to say about this. Number one, Republicans are really aggressively trying to kick a bunch of immigrant children, undocumented and with legal status, off of their healthcare so that they cannot get vaccinations, they cannot get, treatment for asthma or diabetes, right? So this vulnerable split doesn't really make sense. But also, anything that cuts $10 billion a year from the state budget is going to damage all of us. It's going to hurt people who rely on LTSS for home care. It's going to hurt, communities and schools because education funding will be hurt. It's going to reduce the amount of spending we have to invest in childcare, to invest in infrastructure. And finally, not all of us are on Medicaid, but all of us depend on hospitals and providers and local economies even that are supported by Medicaid. And so we'll all be hurt when Medicaid is cut. So this has been a pretty doom and gloom presentation. I do want to say that our advocacy has protected some things already, right? Like already Republicans just rolled out their sort of initial concrete offer, and it's already not as bad as it could have been, right? Like back in February, we were talking about total structural changes to Medicaid, like block granting the program. We were talking about changes to FMAP for the expansion population. And we have beaten those back. And we've also seen that Republicans are kicking the can on some of these proposals, having some of the worst proposals be implemented in 2029 because they know they're unpopular. They know they don't want to run for re-election on them. So we are making some progress here. And also this package, I suspect that some of the congressional Republicans from New York don't totally understand the essential plan and its financing mechanism and the difference between lawful status and undocumented immigrants when it comes to Medicaid and so forth. They probably don't realize that they're voting for something that will eliminate healthcare for, over 1 million people in the course of the next 2 years. And so as they become educated on that, I think we have hope of beating this back. So the next month is critical. I showed a timeline at the beginning, but I know we have people on this call from all over the state, from labor unions and advocacy groups and local activists, and we just need to make sure that that everyday New Yorkers and our leaders understand what is coming for us and are ready to stand up for New Yorkers. Okay, sorry I just talked at you for 45 minutes, 40 minutes even. I'm happy to just sort of take questions. I haven't been looking at the chat, which has 99 new messages in it. But Emily, are you able to help me sort of pull some stuff out of the chat?
Yep. Can you hear me?
Yep.
Okay, so first of all, did you see okay, so just to get you started, there's someone asking currently about language that impacts the essential plan specifically.
Um,
Where it could you just repeat
uh,
sort of like how the funding affects the essential plan, I guess is one.
yeah. So this is a complex issue. So basically, in most states, people go on the exchange and they get premium tax credits on an individual basis. In New York, we do something different. The people who would get premium tax credits, they instead go on the essential plan. And then the federal government, instead of giving them premium tax credits, it gives the state, the equivalent amount of money to provide the essential plan. And so when you read national media coverage about this, you'll only see like they're talking about premium tax credits and premium tax credits would be lower and some categories of immigrants wouldn't be eligible for them. So if you read CNN or Politico or Kaiser Health News, they'll be talking about premium tax credits. For us in New York, we have to read that as meaning the essential plan is getting cut because it's the same sort of funding source. The federal government every year like calculates how much it would have given in premium tax credits, and it instead gives it to us as the essential plan. And now it's going to change that calculation because it's going to say, well, we wouldn't have given premium tax credits for all these lawfully present immigrants, so we're no longer giving you that funding for the essential plan. So that's where the cut's happening there.
Okay, hopefully that was clarifying. It is pretty complicated. The Michael, I don't know if you saw this. I just want to note that the bill failed in the House like right before you started presenting, which I don't think renders all of this meaningless, but I just wanted to make sure you saw that that was sort of happening in the background.
Yes. Okay.
Um,
I have not been checking Twitter the whole past 40 minutes, so my knowledge is already out of date. I see that someone is saying it was voted down by right-wing Republicans who don't think that it cuts enough.
right.
That's a really powerful dynamic here is that these cuts represent a compromise between swing state Republicans and real hardcore right-wingers who want to see more cuts. And each group has enough votes to sink the bill, and neither of them is very happy right now, right? Especially the right-wingers think this doesn't go far enough. The swing staters are rightly worried that they will lose their seats in 2026 if it goes through in its current form. And that dynamic is what might allow us to defeat this whole thing, right? So, we'll see, knock on wood, but that dynamic is powerful.
Okay. Just go back. So someone just asked, does the essential plan cover undocumented workers?
No, it doesn't. So the essential plan covers lawfully present immigrants. And then to the extent that some undocumented, some categories of undocumented immigrants do get coverage in New York, children and people over 65 are the two groups. And children, and the coverage for children is of long-standing. Coverage for those over 65 is more recent from a couple of years ago. There was a push called Coverage for All to cover all undocumented immigrants, but that did not pass in the budget 2 years ago and hasn't been implemented. And so undocumented immigrants of working age between 18 and 65 do not have the ability to enroll in Medicaid. there is a category of Medicaid called emergency Medicaid that will cover emergency care only for them, but they don't get comprehensive New York State Medicaid.
Okay. Also, there's been a suggestion that you stop sharing your screen so that we can see.
Oh, so smart. Yeah. Great suggestion.
So one person that's kind of specific going to the MCO tax said that their understanding was the House E&C committee does not propose eliminating the MCO tax or the provider tax, but only freezing the level going forward. Can you clarify that?
Yeah. So the Energy and Commerce package does two things with respect to provider taxes. It does a moratorium on new provider taxes for everyone, but then leaves the ones that already exist kind of grandfathered in. So the states that got while the getting was good can keep their provider taxes, but other states are out of luck. But it also does this thing which modifies the requirement that provider taxes be generally redistributive, and basically, I would say New York and California found a loophole in the existing generally redistributive language, and they made these special provider taxes called MCO taxes. And the language in the ENC would eliminate those particular provider taxes. And so it's a separate provision from the moratorium that's like really quite targeted at New York and California and just a handful of other states.
So let's see here. Someone asked, what specifically can we do in the next month to stop this bill? And I'll just tie that to a different question, which is how to message the awfulness of this plan to the public when the Republican lawmakers are sort of, trying to message it as waste, fraud, and abuse.
Yeah, so I mean, it's a really good question. So I will say, I see Mark Henne is here from HCAN and Lara Casal from Medicaid Matters. I am a simple policy wonk. I'm not an activist, and I encourage people to get engaged with those activist networks like Medicaid Matters and HCAN. Mark and Lara and anyone else who has sort of links people can click to plug in or to talk to Congress people, please do drop those in the chat and we'll send them out with the presentation slides. In terms of messaging about the awfulness of this, I like what I've seen from folks like Nicole Malliotakis is that they are like, we protected New York State Medicaid from these cuts. We got a nice balanced bill, right? They're sort of declaring victory and saying like, we did what we promised. We protected from the worst potential cuts. And I think that's it says that they understand that their constituents don't want these cuts, but maybe don't understand how draconian the bill they actually voted for is. And so I just think as of Monday night, I think most people in the state didn't understand how catastrophic this would be for New York. Now we do, and now we just say, look, you said you were going to protect vulnerable New Yorkers. You said you weren't like these wingnut Freedom Caucus people. Then stand up and protect them and commit to voting no. Is the best I can say.
Okay. So there have been a couple people asking for clarification about let's see, like the undocumented population versus people who are, quote, not lawfully present. Someone formulated it as, can you please repeat the numbers on both citizens and legal, documented immigrants, lawfully present immigrants who would be impacted by these different cuts? Yeah.
That's a great question. So as you can imagine, these numbers are a little fuzzy, and my colleagues Emily and Andrew, who are on the call, did some great work trying to break them down from census numbers. My understanding is that there are 4.5 million immigrants in New York, meaning, folks who weren't born as US citizens. Of those, 1.8 million are non-citizens. And about 650,000 of those are undocumented. And then the rest, many people on this call are probably gonna know this stuff better than me and tell me I'm dead wrong about this. But just in broad terms, right? We have a lot of undocumented immigrants, over 600,000. And then we have another, 1.2 million immigrants with some form of legal status. And that might be TPS, although a bunch of TPS has been canceled. It might be, H-1B visas. It might be green cards. It might be refugee status or asylum seeker status. And some, but not very many, undocumented immigrants are on New York State Medicaid and CHIP and paid for through state-only programs, and that's mostly children. And then many, many more lawfully present immigrants are on the essential plan because for the same reason that they're also on the ACA exchange in other states, right? Like the way the ACA works is if you're a lawfully present immigrant, you often can't get Medicaid, but you can get ACA premium tax credits. And so the loss of coverage is hard to break down, but significant in the more than a million category, and most of that is lawfully present immigrants.
Thanks. Okay. Someone asked, is Cobra impacted?
No, not as far as I know. There isn't, as far as I know, there's no change to sort of employer-linked healthcare. We should certainly keep an eye on that as a Trump regulatory priority to sort of weaken protections in employer-linked healthcare, but the at issue is mostly public programs.
Okay. Has there been any research into the broader economic hit that these cuts would have in New York State?
Emily, has there been any coverage? Is anyone working on that?
I'm working on it, so watch out for that, I guess. Can you talk more about the impact on citizen children?
Yeah, so just to fill in, so we're working on economic assessments and job loss assessments, but just to say generally, right, healthcare is 20% of the New York State economy. Hospitals and nursing homes are major employers. Home care is a major employer. And that's true in cities across New York and also rural areas across New York. And so anything that really squeezes the budgets of those providers and leads to closure is going to have really significant impacts in terms of job loss. There's a question about how children who are US citizens would be impacted.
Yeah.
Yeah, I mean, I think the answer is like everyone else on Medicaid and CHIP, if the state has way less money, it's going to be able to cover way less people. And so, New York State, for instance, just recently did continuous eligibility for children from age 0 to 6. So that means, if you qualify for Medicaid as a 1-year-old in New York, you don't have to fill out another form when you turn 2. You just are covered from 0 to 6, right? And that's the kind of expansive thing that really helps stabilize people's healthcare, so little children don't have to switch providers or their parents find out when they go in for a vaccination that they're uninsured or whatever, right? And that's the kind of program that we do now because we can afford it, and we won't be able to do it with $10 billion in cuts or more.
Okay. How about, can you say how many citizens would stand to lose health care from cuts to the essential plan?
I can't say because the state doesn't sort of break down enrollment data by immigration status. I would say there are 1.6 million people on the essential plan. Of those, 500,000 are immigrants who are sort of at an income that would make them Medicaid eligible if it weren't for their immigration status. So that leaves another 1.1 million. Ballparking sort of from instinct and from having tried to calculate this out before the call, I would say it's probably, half and half, right? Like sort of 600,000 citizens and 500,000 legal status immigrants among the remainder. So those 600,000 US citizens who's on the essential plan, if the essential plan disappears, then they will have the option of going on the exchange. They'll go on the exchange and there will be the premium tax credits will be lower than they are now. The cost sharing reductions will be lower than they are now. And the coverage will be much, much worse than the essential plan coverage. And so many of those people, potentially hundreds of thousands, might either not be able to afford the exchange coverage or decide that it just sort of isn't worth it. And so there's hundreds of thousands of US citizens who could lose coverage there. But I also want to say the work requirements will be heavily targeted at US citizens. And there's a recent estimate from KFF that suggests that 900,000 New Yorkers could lose coverage just from the work requirements and associated paperwork and bureaucracy. And so that's like that's a little bit farther out as of right now, but it's another huge source of loss of coverage.
Okay, I want to make sure to ask this question. Has Governor Hochul or the New York State Legislature made any provision to address these federal cuts?
Yeah, it's a great question and something we're struggling to understand. In the budget every year, there is a Medicaid global cap, and the Medicaid global cap says if we are spending more than we planned on Medicaid, then the governor has the unilateral authority to do sort of across the board Medicaid cuts. It's like it's not totally clear to me how this might or might not kick us over the cap in this fiscal year. It sort of depends on some complicated accounting and legal maneuvers, but that's a risk. And then the budget also did a provision that the governor would have unilateral authority to do some cuts in management if the state budget is more than $2 billion out of whack. And so there are those sort of really bad sort of nuclear option situations for immediate cash management needs. Otherwise, no. What the governor and legislative leadership have said is, look, like the state, if the Republicans want to cripple Medicaid, then the state can't make up the money. So we're just going to have to cut once we see what they cut. And I think whatever happens with the federal budget, we need to resist that kind of logic. We need to say Medicaid is good for New York. It's a very efficient, very low cost way to provide comprehensive health insurance. It's less expensive and more efficient than employer sponsored healthcare. And our communities depend on it. Our local hospitals depend on it. Our comrades with disabilities and older adults depend on it. And so, if the federal government isn't willing to pay up because it needs to give a big tax cut to the rich, we should tax that money back from the rich and make sure to protect our Medicaid program. But I think the first priority is to avoid getting into that situation by beating back these cuts.
Okay, so Mark Haney has his hand raised.
Yeah, if I may, Michael, and thank you so much. This is a wonderful presentation. And even though I follow this stuff day in and day out, I'm learning stuff. So thanks a lot. I just wanted to comment briefly on what you've talked a lot about the impact on public programs in New York and people who rely on public programs. but it's also going to throw the private insurance market into chaos. Because as more and more people become uninsured, the healthier people who can take the risk are going to leave the pool. And that means premiums and copays and everything are going to go up for everybody else. Those who rely on employer-sponsored coverage, as hospital and healthcare prices go up because of this, your insurance, your deductible, your premium is also going to go up. So everybody has a stake in this fight, no matter what kind of health insurance you've got.
Thanks, Mark.
Well said, yeah.
And also, maybe Michael, is there any effect on Medicare? Some,
I mean, yeah, it's a good question. There are about 1.2 million people in New York State who are on both Medicare and Medicaid. Some of those people receive long-term care from Medicaid and most of their health insurance from Medicare. Others are just, they're on Medicare, but actually being on Medicare is expensive. You have to pay premiums and copays and stuff. And so then the state comes in through the Medicare Savings Program, which is a Medicaid program, and pays copays and premiums and drug costs for low-income Medicare enrollees. And so that's just something to think about when, whenever you hear like an overall number, like 7 million New Yorkers are on Medicaid, a huge number of those people are also on Medicare and are, you know, because they are either older or disabled or they have end-stage renal disease and are getting some support that they really need to pay for copays and stuff. So that'll be one form of impact there.
I just want to recognize that it's 1 o'clock. I scheduled this for an hour and a half, so I think Michael's subject to your timing.
Oh yeah, I can keep going,
for a little
but people
longer,
should feel
keep
free.
asking
I don't want to
questions,
sort of
but
end on
feel
a.
free
Mhm.
to leave if you need to go. And but yeah, we'll hang out. I have a question, which maybe you've already spoken about a bunch, but you know, I feel like in New York State, we also have a really robust home care program. How would that program specifically be affected by some of these changes?
Yeah, it's a really good question. I think that I always tell people, right, it's worth thinking of Medicaid as actually two separate programs, right? There's a program that provides just regular health insurance for mostly low-income people. And then there is, and you know, that's like pretty cheap because most years someone with health insurance doesn't have a major surgery or something. They don't use much health care, right? And so that's on the order of $5,000 or $6,000 per enrollee to cover that. And then there's this other program, which is paying for long-term care, for home care or nursing home care for older adults and disabled people who really, really need it and, you know, would not be able to be safe or even survive without it. And that, you know, because that is targeted at people who actually need the service and use it every year, it's much more expensive per enrollee. And because New York's population is aging, it's also a growing cost per enrollee. This reconciliation bill is going to squeeze the state budget. And when it gets squeezed, the part that is, you know, the part that is growing the fastest and that we need to grow the fastest is the long-term care budget. That's going to be a real, like an incredibly impacted place for this, even though there aren't super specific cuts here targeted at long-term care, because it's the part of the program that is growing and where the budget needs to go up. If the budget doesn't go up, it can't meet the needs it's trying to serve. And, you know, I would expect that this will put us in a situation where we have to do eligibility cuts, you know, hours caps, like all of these things that that red states do that really restrict access to home care, often force people into nursing homes or force people to lose their independence. And so that's yeah, that's the impact is through this sort of overall budget cut.
Thanks.
I see Maya is asking about emergency Medicaid. So emergency Medicaid is covers emergency care for people regardless of immigration status if they, come to an emergency room and present with it, right? And that's a form of care that hospitals are legally required to provide regardless of immigration status. And so sometimes I joke that emergency Medicaid is insurance against a risk hospitals face that an undocumented immigrant could show up without insurance in their ER, right? Like it protects them from the risk of having to provide care for free there. As far as I understand, that will not be impacted. I mean, again, because it's in a way, it's less a benefit to the person, right, who would get care either way because they're entitled to it than it is to the providers. And Maya also asks about Medicaid coverage for people who are undocumented and are seniors, which New York added relatively recently, a couple of years ago. So for people who are 65 plus. And that's provided without without any federal match, right? Like that's just New York State deciding to do something with its own money. The way the reconciliation bill is structured is that if we cover even any undocumented immigrants, including little children, like anyone at all, then we lose this huge amount. We lose $2 billion of federal funding a year. And so what that means is, right, like, the state isn't in a place where it has to decide, oh, like which undocumented, should we cut coverage for some categories of undocumented immigrants and not others or whatever. If to the extent that we want to make it possible for undocumented children to get vaccinations and asthma inhalers and type 1 diabetes care, we will be facing $2 billion a year in federal cuts. And I for one hope that we continue to provide that coverage. And so, the different categories that people might disagree with of undocumented coverage don't arise in that sense.
Arlene Geiger has her hand up.
Yeah, so the question is really about the bill out there now. So somebody said that that it got voted down. Could they bring it up and reconfigure, the elements and keep trying? And is there any limit as to how many reconfigurations they try and get voted, not have enough, have more than 4 no's? So yeah, just about that. If anybody knows.
Sorry, does someone else want to speak to that?
My understanding is the House Budget Committee that voted down the bill today only packages together what came out of the various committees. They cannot change any of that. However, the House Rules Committee, when it meets, can make changes in it. So I think the idea is Speaker Johnson will negotiate behind the scenes to work this out. It will move through the Budget Committee as it exists now, and then they will make changes when it gets to the Rules Committee.
So just to follow up with that, since the salt, how much of a salt, how much of an increase the cap in salt would be is a big thing for Lawler and his moderates, and cutting more things to the bone is a big thing for the Freedom Caucus guys. Does it sound like there is something that could change within those boundaries by the Rules Committee that would make
that's if the Speaker is able to negotiate a compromise between those two factions and move the bill forward, then the Rules Committee would make those changes when it gets to them.
When would it get to them? Is that after
the House
Senate?
Budget Committee moves it out?
Oh, okay, so it moved out to the floor for the. So it's now being voted down no, it's voted down in the floor now, right?
No, it has not yet gone to the floor. It's only in the Budget Committee.
Oh, okay, so but once it goes to the floor, if they have a vote down, they can't redo it, right?
It will only go to the floor if the speaker has the votes. It will not go to the floor if he does not have the votes.
Okay, so now it's just ruled out in the committee, they're working it out and it's pushed. Okay, thank you,
You're
Mark.
welcome.
Yeah, so it's going to be it's going to be, you know, that I think this process will continue through next week, and I think there's a really good chance that this bill actually does get worse next week rather than better, as Mike Johnson tries to satisfy both like sort of hardcore right wingers who want to see deficit reduction, but also some representatives who really care about the state and local tax deduction more than they care about an insurance. So let's keep an eye on this.
And the
I'm
salt,
getting a little bit.
just a little comment, the salt goes away, it is eliminated if this bill fails, because the salt was an invention of the 2017 Trump tax.
Mm,
Yeah, it's eliminated because it was part of the 2000. So I mean, on the flyer we're emphasizing that.
that's great.
Yeah.
That's helpful. Got it. Um, okay, well, I'm getting a little hoarse here. So I want I want to sort of move to and also I think this is this is part of a longer conversation. I really appreciate that folks made the time to listen in. We will send out the slides, and I will make sure to get links to advocacy avenues in that email as well. But I want to say, if you have other questions about something specific, or if I got something wrong and you were too polite to tell me on the call but would like to tell me now, I'm dropping my email in the chat, Kinnucan@fiscalpolicy.org. And I'm always really happy to talk Medicaid, and really grateful to you all for the work you're doing to help protect it.
Awesome. And I'll just point out again that there have been some links dropped in the chat for the Medicaid Matters fact sheets that I think are really great and can be helpful with advocacy work. They have numbers for how different congressional districts are impacted by cuts and others. So
yeah.
And various populations and within it,
and
like
yeah,
children.
thank you. And various populations like children and immigrants, undocumented, documented.
Yeah.
I have a
All right.
request. Is there any way to codify what Mark spoke about, people losing, people who are insured through their employment who are nothing to do with Medicaid, that this will actually hurt them too? Because the more personal it is to them, the more likely they are going to also possibly advocate with their local people. It upends
Yeah.
everyone's life because all of us on this call have a stake. The rest of the population doesn't seem to have a stake. But if this happens, they will have a stake.
Yeah. I'll say, number one, Mark, maybe I'll try to connect with you and see how we can put some numbers on that. The other thing I would say is
there's someone here from the state AFL, the national AFL, may be producing those numbers about what is going to be the impact of this package on employer-sponsored coverage.
Yeah. So we'll try to identify that. The other thing I would say is, a lot of times people don't understand that when their mom or their aunt or their grandma got home care or had their nursing home, that wasn't Medicare, it was Medicaid. They don't understand that the local hospital where their kids were born is kept open by Medicaid funding. And so there is, I think, Medicaid is like this, it's so important, but a lot of people haven't heard of it. I also think it's worth emphasizing, right, that like the essential plan is, it covers a lot of people who work full-time at employers that just don't happen to offer insurance. When I was freelancing, I was on the essential plan for a while. And so, there is this sort of, but yeah, it's important to think about all the other stakes people might have.
Well, also, I would say, like, I think someone brought up like economic impacts. I think I'm working on a short brief on sort of broader economic impacts. And I think, Michael, tell me if I'm wrong, but I think hospitals will be like really deeply affected. So when hospitals and other providers are affected, that's going to affect services for everyone. So I guess Mark was talking about insurance pools. I think also sort of the fact that providers, budgets are going to be deeply affected will impact sort of healthcare provision for everyone. So anyway, we can try to build out more sort of specific numbers on this.
Yeah. All right. Well, I have to jump, but this was so great, and I'm excited to talk more with all of you and see you in the streets as we continue to fight this passage.
Thank you.